Today we're joined by mother-daughter, a duo, Thea and Kiera Lazuriaga. They are esteemed insurance agents that are licensed in multiple states. They are here to talk about how they can guide us through the open enrollment process and Medicare with the company Medicare. Good to see you guys. Thank you so much for being here.
Thank you so much for having us.
What a duo, right? Right. So Kiera, talk about, first of all, what is it like to be, to be esteemed and licensed in multiple states, and then working with mom can't be that bad. It has to be pretty great, right? What have you learned from her over the years?
She's been in the industry for almost 20 years. Essentially, when I was a toddler, she started learning about Medicare, and for a lot of that time that she was working in the industry, she worked from home. It's kind of inherent the way that I would listen to the Medicare sales calls and all of that vocabulary is almost instilled in me, so that definitely gave me a big advantage coming into this industry, you know, enriched with that knowledge that I've been surrounded with for so long. And definitely very exciting to finally be on board and finally be licensed. It's not an easy process whatsoever. They definitely make you work for it, which of course when you're dealing with people's insurance, you know, you have to be very educated about what's going on. So I got my bachelor's degree, and then right after that I got my life accident and health producer's license, and then after that I had to get certified by Medicare through AHIP, and then I had to get certified by every carrier. So it was a lengthy process, but extremely worthwhile. And I've already gotten the chance to work with many wonderful clients, and I'm blessed to work with a team that prioritizes helping others and having a career built on the foundation of making a difference in people's lives. And not only that, but my parents have always been selfless and they raised me to be kind, and I think just naturally as Filipinos, we are very hospitable and very warm. I think the most important thing that she's taught me is to just always follow the golden rule and to do what's ultimately best for our clients at no cost for life.
At all times.
And let's talk about what Medicare does for people who don't know, because the open enrollment and the Medicare process, it is very convoluted. And having all those degrees and certifications and, you know, knowing all of that is really the team that you want navigating you through this. I mean, that's what you guys do day in and day out.
That's correct.
Absolutely.
That's correct. So Medicare is basically a health insurance agency. I have been a trusted Medicare advisor for over 18 years now. What that means is Medicare can be very overwhelming, confusing, very daunting. So because of that, what we do is really hold the hands of Medicare recipients in their journey with their research, enrollment, and beyond. So we help them, we give proper advice, because each person has a different situation. Some of them can refuse Medicare, some of them will have to sign up for Medicare, some of them are eligible for state assistance, some of them can reduce their Medicare premiums. Each individual has a different situation. Even a husband and wife have different situations. So we're there for them, and we do provide a lifetime customer service with their Medicare research.
I love that, and I would think about it like you wouldn't jump into a roaring river without a guide who didn't know what to do.
Exactly.
And so they want someone who actually has the benefits and knows the holes and ins and outs to be able to do that. What would you say to folks right now that are, you know, anticipating all of these enrollments and things to sign up for, and they're like, I'm just really frustrated, I don't know what to do. Is there a cost for the service? What would you say to those folks that are about to be in that process right now?
So first of all, number one, I named the company Medicare because I truly care. So yes, Kiera is my daughter, and I'm very happy that she has decided to come on board. I take pride in that. She has worked so hard to be licensed, but I just am amazed at how she serves people on a daily basis, okay? So what we do here is, first of all, give us a call, make your life simple. Anyway, we don't charge a fee. Like I said, Kiera is my daughter. My clients, I treat them like my kids because I'm very passionate. I protect them, make sure they're put in the right plan. So make your life simple. Give us a call, 864-625-2112. Website is MedicareTLC.com. Also, I'm part of what's called the National Association of Benefits and Insurance Professionals. There are upcoming changes in 2025. It's called the Inflation Reduction Act. It has been finalized. It will happen January 1st, 2025, which means for you folks who take expensive medications, the donut hole goes away. So there will be no more coverage gap, and your medications will be capped at $2,000. So that is such great help. That is great information and great help for you folks. And the advantage of us being lobbyists, part of that NABIP, is we get firsthand information of the government rules and regulations that really affects each individual. So we really, truly take pride in what we do.
Awesome. That's why you want the Medicare team. We'll, of course, put all that information, MedicareTLC.com. The number was on your screen. We'll put it at our website, yourcarolina.tv. A good team that cares about our community. Thank you so much, guys.
Thank you.